Okay, so we're going ahead and get started, and I'm going to turn things over to Dr. Hooser, and she's going to take us through this great topic.
All right, thank you for having me today. So our presentation, as Michelle said, is going to be about Scottish Terrier liver enzyme elevation. We'll kind of talk about the liver in general, diagnostics, when you might need to look into it further. So just a brief introduction. I graduated from Purdue University College of Veterinary Medicine in the class of 2021. Currently, I'm practicing at Wilson Veterinary Hospital in Washington, Michigan. My professional interests lie more in reproduction as well as sports medicine and rehabilitation. I've been involved in the dog world for a while. I'm currently the chairperson of my national breed club, the Papillon Club of America, our genetics research committee. So brief outline. So we're going to discuss several possible liver diseases, including clinical signs, diagnostic tests, and treatments. And then we'll also cover a little more in-depth vacuolar hepatopathy in Scottish Terriers. So just a brief kind of statement. So this is mostly supposed to be educational. Don't necessarily take this as medical advice. If you have questions about your Scottie, please consult with your veterinarian and they can best advise you on how to move forward with diagnostics and treatments. Okay, so just starting with the normal liver. So the liver is comprised of 6 lobes, and within those is what's called the hepatic portal system. So this is where our blood's, oxygenated, deoxygenated blood is going through it. All of the GI filter or products from the GI tract are getting filtered. So it does a lot of things for us. It metabolizes a lot of products like bilirubin, bile acids, carbohydrates, lipids, different medications we're putting in our dogs and in ourselves. Different toxins are getting sent through the liver. It does a lot of that. There's a lot of hormones it produces. It produces a lot of our blood clotting factors as well as proteins. One of the biggest products is bile that it secretes, but it also aids in the removal of ammonia. And then a lot of things are stored in the liver as well, like glucose glycogen. So then kind of briefly, we'll talk about 3 of the kind of more common liver dysfunctions. So portosystemic shunts, microvascular dysplasia, and then copper hepatopathy. So portosystemic shunts, so that's when there's a vessel present that allows blood to basically bypass the liver. So it's not getting filtered and it's going right back into the systemic circulation. So there's 2 main types, intrahepatic and extrahepatic. So intrahepatic is where it actually exists within the liver itself. Usually these are much smaller vessels. So in the picture in the bottom, that would be V, where that exists within the liver. And then there's extrahepatic, where the vessel is actually outside the liver. And so that's completely bypassing the liver itself. So clinical signs, typically they show up more when they're young, but if they're not very bad shunts, sometimes we don't catch them or notice anything until the animals are older. But for bad ones, they usually show up as what people usually describe as unthrifty puppies. They're just not doing well. They're not putting on weight. In adults, weight loss, poor appetite or anorexia, not wanting to eat, vomiting. We can see like urinary tract signs with this. And then the biggest kind, most classical one would be what's called hepatic encephalopathy. So that would be like neurologic signs, especially following eating. And we'll talk about that a little more. And then because the liver is being affected, we can see coagulopathies with this. Treatment, the medical is just symptomatic. With medical treatment, we're not actually treating the shunt itself. So we're giving them a diet that's low in protein, high in fiber. We can use some medications such as lactulose, different antibiotics like amoxicillin, and then putting them on supplements that support the liver like denomyr, milk thistle. There's other ones out there. And then surgical, where we're actually going in, we're trying to close the shunt itself, like putting in a ring, like the picture shown there. And then in some cases, when surgical is possible, usually chronic medical management is not necessary. Typically you get complete resolution, but that is not always the case. So then hepatic encephalopathy. So when protein is digested and broken down, ammonia is formed, and that ammonia is taken out of the blood by the liver. So if the liver is not functioning correctly, that ammonia is left in the blood. And so that leads to these neurologic signs that we see, most commonly following a meal, especially a high protein meal. So that's where we'll see things where they're disoriented, they're head pressing, they're incoordinated, possibly even seizures, pacing, things like that. And so the biggest thing there is trying to feed a low protein and a high carbohydrate diet, because that's producing less ammonia in the system. So then microvascular dysplasia. So this is where there's just underdeveloped microscopic blood vessels in the liver itself. And so usually this is actually asymptomatic. We don't always even know that this is going on. If it's more severe, then they're going to present very similarly to a portosystemic shunt. You see just kind of like unthrifty, not really wanting to eat, not gaining weight. But this can be there in addition to other liver diseases. And so typically this isn't as severe, but it kind of acts somewhat like a shunt. When they're asymptomatic, there's really no treatment for it besides liver support. If they are symptomatic, very similar to the shunts. So wanting to do liver supplements, possibly lactulose, antibiotics, those sorts of things. For microvascular dysplasia, there is really no surgical treatment. And then copper hepatopathy. So this is when there is copper accumulation in the liver at toxic levels. And this is bad because it causes damage to the liver cells, leading to liver cirrhosis. Some breeds do have a genetic mutation affecting copper extraction, so that we see then this buildup of copper. And so there's still ongoing discussions on if the chelated copper in our current dog foods is contributing to this or not. And I think as of yet, we still haven't come up on a clear consensus. But one of the things when you're looking at it is biopsies. And so there's a special stain that they use to actually look for the liver, or the copper itself within the liver cells. And so this is a lot similar to other liver signs with the other diseases: increased urination, increased drinking, lethargy, vomiting, neurologic signs, jaundice, those sorts of things. Diagnostics, blood work. You're going to want to do a biopsy with a specialized staining of the histology sample, because you can't really diagnose copper hepatopathy without that biopsy. You can do some measurement of copper levels in the blood. And then if it's a breed that's affected, some breeds have genetic tests available to look for that. Initial treatment is aimed at helping the copper excretion from the body and decreasing copper absorption from the GI tract. So we're also giving medications that bind copper. And then you're wanting to give antioxidants to help reduce oxidative damage to the liver cells. And there are some foods now that are aiming to have lower levels of copper in them, like the Scoop dog food. So then kind of diagnostics in general that we're looking for with liver disease. So the first is, just basic blood work. You're wanting to have a complete blood count. And this is mainly looking for possibly like anemia. If we're having coagulopathies, we want to see if our red blood cells are low. Chemistries, we're going to look at the different liver enzymes that are most important to us. We'll talk about those just a little bit more. So that's ALT or alanine transaminase, ALP or alkaline phosphatase, AST, aspartate aminotransferase, GGT, gamma glutamyltransferase, and then bilirubin and albumin. A big one too that we're looking at is paired bile acid tests. This is probably more important to shunts, but we can use it in other diseases as well. And we can also use it to rule out other things. And so this is measuring the liver's ability to absorb bile acids after a meal. So they're usually always paired. So you have the dog fast, usually for at least 12 hours. With puppies, sometimes we do a shorter amount of time. You'll take one sample after they fasted, one blood sample, and then you'll give them a meal, and then you'll take another sample 1 to 2 hours after they had that meal. So it's called the postprandial sample or post-eating sample. And then we're looking for an elevation after they've eaten, because if they're normal, if they don't have anything going on with their liver, both samples should be normal bile acid levels. If they're affected, the post-eating, the postprandial sample will be elevated. And then another thing we can measure is protein C. So it's a clotting factor that is produced by the liver. In dogs with portosystemic shunts, this is typically lower, where with microvascular dysplasia, it's typically normal or a little elevated. So this test does let us look more at, is it microvascular dysplasia or is it a shunt, if that's kind of the route we're going down diagnostically. So these are kind of the main liver enzymes that you're most commonly going to see, just like on a general blood panel. There are a few more specialized ones that can be done kind of individually, but on most chemistries, these will be on there, at least most full chemistries. So alanine transaminase, so that's a component that's released during cell injury. It is mostly liver specific. There's a few rare exceptions, but in general, when it's elevated, that's typically contributed to the liver itself. So it's a fairly specific diagnostic we can look at. Alkaline phosphatase, so it's more looking at cholestasis, which is when there's decreased bile flow within the liver. It's not as specific. There are what's called different isoenzymes, so it can be released from different parts of the body. And the main one is liver, so it still is a good indication of that, but it also can be released in part due to like bone injury. We can see increases when they're on like corticosteroids, like prednisone, some anticonvulsants. There's one that's intestinal. So not all elevations in alkaline phosphatase necessarily are the liver, but for the most part, most of them we would consider that there is some disease process or something going on with the liver if we see an elevation, especially if it's kind of a moderate elevation there. One thing it can look at too, it's a big value we look at with Cushing's disease, especially if it's quite high. That's kind of an indication of Cushing's disease, as it would warrant further testing there. And then AST, aspartate aminotransferase, it's another one that's released during cell injury. It can though come from both liver cells and muscle cells. So if it's elevated, but there's a history of, bruising, some sort of traumatic injury, sometimes it can just be contributing to that or from that. Even things occasionally like, if the blood draw, the animal's very wiggly, things like that. Sometimes in part it can be due to that if it's just a very small increase. And then gamma glutamyl transferase, GGT, is looking more at if it's elevated biliary hyperplasia and cholestasis. So in most of these enzymes, we're looking at increases of. Decreases can sometimes indicate things, but for the most part, it's increases that we're concerned about. So bilirubin is a product that's created by the liver, eventually becomes bile acids. So when it's elevated, we're seeing that there's cholestasis in the liver. We're not really producing as much bile as we should. And then there are two forms of bilirubin, unconjugated and conjugated. So most blood panels, just basic ones, are just looking at total bilirubin. That's taking into consideration both, but you can break it down as well, and you can look at the unconjugated and conjugated separately if that's a test that we need to do in addition to that. And then albumin, it's a protein that's produced. It's non-specific to the liver. There's quite a few things that can cause albumin to be elevated, but one of the things is bilirubin does, when it's conjugated, is attached to albumin. So it's a value that we're still interested in. And especially in Scottish Terriers, there has been some correlation to increased albumin and hepatocellular carcinoma. So this is not something that's always there, but it can be. So then a little bit closer look at the different diagnostics we do besides blood work. So a big one that we like to start with is ultrasound. That's because it's non-invasive. It can give us a good idea of what we're looking at. So you can look to see, does the liver look small? So this is usually fairly subjective, but we can take measurements. Sometimes you can see liver shunts on ultrasound, but not always. So if they don't see a shunt, you can't completely rule it out. But if you see one, then obviously you can say there is a liver shunt. And then we can use ultrasound as well to obtain biopsies if we need to. For shunts, usually the next step, if it's not just found on ultrasound, would be to do a CT or an MRI to actually visualize the shunt. This would be more important if you do think you want to possibly pursue surgical correction of that shunt, because they need to know where it is, you know, how big is it intrahepatic, is it extrahepatic, because that's all going to depend on, can it be surgically corrected and what the chance of success with that is. Sometimes there can't even be multiple shunts, so those are all the things that like CT or MRI would tell us. Most of the time, most doctors are usually going to do CT, but sometimes they'll do MRI as well. Urinalysis, we'll want to do that because especially with shunts, there can be ammonium biurate crystals present, and those are very specific to that. We don't see crystals like that with other things. You can also look for bilirubin in the urine itself, and that's going to tell you that there is liver dysfunction going on, because there really shouldn't be much bilirubin to speak of that's being excreted into the urine. You can just look at blood ammonia. Oftentimes, if we're really worried about hepatic encephalopathy, we'll test the ammonia itself, and then doing coagulation tests like APT, APTT, those sorts of tests to look and see if our clotting abilities have been affected. All right, so then Scottish Terrier vacuolar hepatopathy. So vacuoles are storage areas of the cell. So if you're looking at a picture of their cell, they're usually kind of in the nucleus, these bigger areas that can be filled with substances or within the cell, sorry, not just within the nucleus. One of the things that they can be filled with is glycogen, especially when they're in the liver. That's a product that's stored there. Sometimes there can be so much glycogen stored in them that the vacuoles are actually becoming distended, and that can happen in Scottish Terriers. And that actually starts to cause damage to the cell itself when these vacuoles are so distended. We see this more so in middle-aged to older dogs. It typically is progressive, and we can see it lead to liver failure or hepatocellular carcinoma. So clinical signs, a lot of dogs can start off asymptomatic and we don't see anything. Might just, happen to find it incidentally on blood work. But some will see clinical signs similar to hyperadrenocorticism or Cushing's disease. So just kind of unthrifty, poor hair coat. Sometimes we'll get that kind of pot-bellied appearance. It can just be kind of general, not doing well signs. Starting with, we'll just want to look at general blood work. And typically we'll see at least elevated alkaline phosphatase, but the other enzymes can be elevated as well. So first, wanting to rule out before we really confirm or go down the path of vacuolar hepatopathy, wanting to rule out any other causes of elevated liver enzymes. So looking to C2 history, what kind of drugs have they been on in the past? Are any of those ones that could have caused this rise in ALP? Have they been exposed to any toxins recently that possibly could have caused this? Go down, do more testing for Cushing's disease. Diabetes occasionally can cause rises in liver enzymes. Pancreatitis, want to rule that out, or any other chronic inflammatory processes, or even like infectious. So the more specific diagnostics to kind of rule in or out Cushing's disease, we'll want to look at doing an ACTH stimulation or low dose dexamethasone suppression tests. And so those are usually ones where the dog goes for the day because we have to take a couple of blood samples. Wanting to do paired bile acid tests like we talked about before, make sure it's not something like a liver shunt. Ultrasound can't definitively rule in or out vacuolar hepatopathy, but we can look to see for other things. Are there any masses that are noticed on the liver, any other abnormalities? We can look for things like with Cushing's disease, we usually see increases in adrenal glands. Do those look larger or smaller? Any other lymph node enlargements throughout the abdomen? So it can still give us a lot of information, and it can be an indication of when we might want to do biopsies. To really rule it in or out, you do need to do a biopsy, but they might want to try the least invasive thing first, which would be like a medication trial, possibly on one of those medications we talked about, lactulose, antibiotics, or possibly just a liver supplement first and see if there's any response to that. So again, kind of the ultrasound, like we're talking about looking for masses, is there any cause for concern of like hepatocellular carcinoma? You can also look for gallbladder disease. Are you seeing anything abnormal? Gallbladder stone, sludge, things like that. Pancreatitis. Does the pancreas look inflamed? Are there any abnormal spaces on that? Enlarged adrenal glands is indications of Cushing's disease. But I did talk with an internal medicine specialist that I know, while ultrasound's always good, you can get an idea on if you want to do a biopsy or not, but occasionally there are times where there might be a spot that is hepatocellular carcinoma and it doesn't always look as bad as it could be. So you can't always rule things out, but it can be an indication. So liver biopsies typically are needed to confirm a diagnosis. If it's not something like a shunt, if we're looking at microvascular dysplasia, possibly carcinoma, or vacuolar hepatopathy, copper hepatopathy, we need a biopsy to look at those under the microscope. And really anytime a primary liver disease is suspected, like everything else has been ruled out, if you're wanting to go all the way and find out what it actually is, we're going to need to send out a liver biopsy. So the exact pathophysiology is still unknown, why exactly it happens. But there has been some studies showing that it can be related to the overproduction of sex hormones, such as like progestins, progesterone, and androgens, testosterone. But in that kind of going along with hyperadrenal corticism as well, the increase in the adrenal glands. But it's not always noted that we see like hyperadrenal corticism or really any changes in the adrenal glands themselves. And they may or may not have clinical signs indicative of Cushing's disease. There's some that will still, if they have those clinical signs, we do the testing, it does look like concurrent for Cushing's disease. There have been some dogs that have been treated as such, and sometimes it's unsuccessful or it can lead to further complications. And that's, I think, where there's still discussion on what exactly is happening in these dogs that some do not present for Cushing's disease, and why is the typical treatment like with trilostane for Cushing's disease, possibly prednisone, not successful in these dogs. What else is going on? So they're looking at, possibly these additional sex hormones that are being overproduced, possibly being the cause of why we're seeing these further complications in these dogs. So it'd be a discussion of, do we actually want to treat for Cushing's disease or not when we're seeing these clinical signs and blood work changes? So monitoring in these studies, especially like the Cartwright et al. Paper that was in JAMA in 2014. So about 25% of Scottish Terriers with vacuolar hepatopathy have a progressive disease, eventually ending in liver failure. In one study, 34% of these dogs, when they started into the study, also had detectable hepatocellular carcinoma at the time of their surgery or later at necropsy. And so they really recommend that in any Scottie that has elevated ALP or other elevated liver enzymes, that they have ultrasounds performed every 6 to 12 months, just to look for changes in the liver, any obvious masses, things like that. And then going from there, deciding if a biopsy is needed to be done or not. And then if, a biopsy is sent out, they are seeing indication of hepatocellular carcinoma, surgical removal is typically indicated there. So then I have a couple of cases that were given to us by Erica. So I have the blood work, but I'll let her talk more about kind of their presenting signs, clinical signs that they had throughout, and then kind of what the outcomes were. So for this first one, this was a 10-year-old female spayed Scottish Terrier. From her blood work, really the only changes are the 2 liver enzymes, ALT is elevated, and then the alkaline phosphatase. And so as a fairly commonly a high alkaline phosphatase of like 1600, when normals usually, the high end of normals around 131. The rest of her blood work relatively normal. And there's a change in the platelet count, but it's right now it's not that low to really be affecting her clotting abilities. So if Erica would want to just give more on this, Scottie, kind of like overall what happened with her case.
I don't have the name on here, so I think it was Annabelle. she ended up, she's still alive. She had a growth on her adrenal gland that was found in an incidental finding. She didn't have any symptoms at all.
Mhm.
But when we did the original blood work, when she came in and we saw all this, we were concerned, obviously, what was going on there. We knew something was going on. We didn't know what it was. So the next step was to do an ultrasound, and that's when they found it. So right now they're just watching it.
Okay.
She has no symptoms, but we're watching it.
Mhm. And when was this first, sorry if you mentioned it, when was this first found?
It was, well, we found it when we brought her, when she came into rescue. So it was, within the last maybe 8 months,
Okay.
maybe 9, something, less than a year,
Okay.
but not like right recent. So we've done several blood tests since then. So
Okay.
she's doing well.
Good.
Thankfully.
Good.
Thankfully.
All right. And then the other 6-year-old neutered male Scottish Terrier. I believe this was Blake. So
Oh, Sugar Ray.
oh,
yeah.
sorry, Sugar Ray.
Sugar Ray, unfortunately, we followed this down, and after we did the ultrasound, he had advanced bladder cancer. And he died just when he turned 7.
Mhm.
We did chemo, we tried everything. It didn't help. It was very aggressive.
Mhm. Was this blood work done? Do you know, did he ever have any changes in kind of more of his like kidney values, or mainly just the liver
No.
values that were seen on him?
It was just the liver, nothing else showed
Mhm.
up. So we really didn't take it all that seriously at first,
Yeah.
but especially since he was asymptomatic.
Mhm.
But it just shows that it can just be some inflammatory process that's going on somewhere in the body. It doesn't have to necessarily be in an organ. It can just be, a growth somewhere, anywhere, even not in an organ.
Mhm. Yeah, because he definitely shows, I mean, the elevated neutrophils, the white blood cells, probably from an inflammatory process, infectious process. His alkaline phosphatase also very elevated. That was kind of his main liver value that was changed, as well as kind of a low amylase, but low is not as concerning. And so was he ever, they didn't find any like ultrasonographic changes in his liver. It was just the changes in the bladder that they found.
Yeah, I would say that it just showed that some inflammation was going on.
Mhm.
And I think that, just because of the bladder tumor being even as advanced as it was, there was, inflammation and probably infection in the bladder at that point from the growth. And so we treated him with the antibiotics, but of course, that we knew that wasn't going to fix the bladder cancer. It was just going to make him more comfortable for a while and maybe less blood. But eventually it did spread very fast. His blood work still stayed pretty decent even through the chemo. But eventually he had a blockage in his ureter. So that was the deciding factor.
Yeah.
Too young.
Yeah, definitely. So always hard when we have other masses like that.
Yep.
Especially I know in Scotties, the bladder cancer as well.
Yeah.
I think those were the 2 cases I picked out.
The ones that I sent you were all dogs that had actually growths in different areas. One had lymphoma. One had that. One had the one on the adrenal gland, the bladder cancer, and one had a growth in his rectum, which we had removed, and then one had Cushing's. So those are kind of the things we usually see in rescue. Sometimes liver cancer, and when we see that, the liver enzymes are hugely elevated. I mean, tens of thousands sometimes, really off the charts. So
Yeah, and like here alkaline phosphatase are on like 2000. I mean, that's definitely elevated for sure, but like you were saying with some of the more severe ones, things like that, I mean, you can see alkaline phosphatase even get up into the, high thousands, 10,000s even sometimes.
Yeah, yeah. We had somebody who came in with 6,000, and
Mhm.
he ultrasounded him, and his liver was consumed with cancer.
Mhm.
So sometimes it's just an irritant. Or we also had one that I didn't list here that had what do you call it, mucocele, the gallbladder.
Mhm.
The gallbladder was so sludged up that I guess it closed off. And even with surgery, it was too late. We got him in at a late stage. But his liver enzymes were very elevated.
Yeah.
So,
Yeah, and like that's one of the things too, when you see elevated liver enzymes to rule out is things like gallbladder, because that we can treat differently. I know it must be hard too, especially with the rescue when you're getting them in. Sometimes, and these are already, progressed to the point where sometimes it's difficult to do, any treatment at that point. So that's why hopefully with, our younger dogs, ones that we personally own, we can do monitoring earlier in life, hopefully catch these things, before
right,
they get to that point.
right. And I was looking through all the list of things that you had as to what were reasons, and I think I've run into most of those. I mean, we had one that had a blockage. You were saying the cholestasis. We had one that had a blockage, and even though we did surgery and removed the blockage, everything had already started shutting down.
Mhm.
So he was not an old dog, and he was not sick other than the blockage, but he didn't make it.
Mhm. Yeah, which is always really hard to try and do all these things, and then, if it's still just too progressed to get a good outcome.
Yep. Yep. Ultrasound is great because you could really see what's going on in most cases. I mean, not necessarily in the liver shunts, but at least in most of the stuff that's going on.
Mhm. Yeah, and it's, it's not invasive. It gives us a lot of information, so it's definitely a good tool that we have.
Yeah.
Okay. So that's kind of my presentation. I just want to thank the Door County Scottie Rally for letting me talk. Mika Bond, DVM, she's an internal medicine specialist that helped me some with this presentation. She's based out of Wisconsin. And then also, in special memory of Barbara, I know she's a good friend to a lot of us. She's a good friend to me. She helped me a lot with dog sports as I was just getting involved, me as well as my mom. So I know that she's dearly missed, and I just wanted this in memory of her as well. So if there's any questions, I'd be happy to do my best to answer those.
Thank you, Blair. That was really informative. I am wondering if you could just go over emphasize the point that you emphasized about doing ultrasounds every 6 months once. Was it the ALP was elevated? Was that the enzyme that you were talking about? So once that's elevated, and at what point should people start doing that? Like if it's elevated by 10 points or 100 points or any elevation?
I would start really with any elevation, and especially the ALP, but really any liver enzyme. I mean, you can, if it's still just like a small elevation, can try other things first. I mean, trying to rule out some of these other diseases, or even just try a course of, like supplements, liver supportive supplements. Usually, like in my practice, we'll start you on those for a month, recheck and see if there's a change. So it's not like we're going long periods of time without following up again. But you can, if you're wanting to be aggressive with diagnostics, I mean, could jump right to an ultrasound at that point, and then monitoring every 6 to 12 months to look at changes, anything new that's coming up. I'd also be wanting to check those liver enzymes and seeing if they're changing as well over that period of time. Because sometimes in our older dogs, we can see ALP elevation, and it's usually not a huge elevation, more of a mild one just with age itself. But especially with any like large elevation, you'll be wanting to do more diagnostics.
And can you, we have a question from Karen Snyder asking you if you could talk a little bit more about the use of supplements, perhaps dosing and name brands or over-the-counter recommendations.
Yeah, so the most common liver supplements, some of this too will just depend on practice preference. I mean, there's a lot of supplements out there and different doctors have their favorites. The one that we use a lot that I like is Denamarin. I think there's an over-the-counter as well as a prescription formula. Those it typically it goes by weight. I think most of the time it ends up being like one to 1.5 tablets once a day. And then usually when we first start on that, we would recheck in about a month to see if there's any change. Hopefully we'd see a decrease in liver enzymes. If not, then more follow-up would be warranted. There's a lot out there though. I know VetriScience makes a liver supplement. They changed. It used to be VetriLiver. I think it's now called like Hepatoclear. Some of the other ones. I can't think right now of the other kind of name brand ones we see in practice a lot. But another big ingredient that you want to look for is milk thistle. I mean, that's in Denamarin, it's in VetriScience. You can get the milk thistle just by itself. Over the counter, I know they make it for people. I've had people do that as well, especially if there's cost concerns, because sometimes the liver supplements can get expensive. Some of the things too, and like in Denamarin, that's nice, is it also has that kind of antioxidant SAMe in it, which I think is a nice addition. But if you're not wanting to go that route, I'd at least try something with milk thistle extract in it.
We have a question from Julie Allen. What about milk thistle prophylactically before any problems with elevation exist?
I think that would be fine. I mean, with most supplements, there's no really side effects to them. So I don't think it's going to hurt. You can't say how much it's helping. I mean, especially with things like, hepatocellular carcinoma. I mean, if they're going to get it, even if they're, going to develop it, the supplement is only going to do so much. But I definitely don't think it would hurt to have them on a liver supplement if you wanted to start them on that.
Let's see, there's a question from Roseanne. My two older ages, 12 and 10 Scotties, have been on Genesil, and I have opted not to have a biopsy given they've been doing well. Would you recommend a biopsy for further diagnostic at that point?
And I assume they've had elevated enzymes, is that correct? And that's where they've been started?
I'm assuming so. Yes.
So, I mean, that's, ultimately that's kind of up to you on how aggressive you want to be with diagnostics. Because a biopsy, I mean, they're not terribly, invasive, especially if they're ultrasound guided, but I mean, it is a biopsy. You are taking a small piece of the liver. If they're asymptomatic, I mean, the question is it, one of these processes that, it is never going to bother them, it's never going to get worse. I mean, that's, a possibility. It could be something completely unrelated, to things like vacuolar hepatopathy, but without a biopsy, we just don't necessarily know. And that really does just come down to owner preference, like, especially with asymptomatic dogs, do you want to know, do you want to try and catch things early, or if they're doing well, I mean, do you just keep monitoring until you start noticing other signs? I definitely say, I mean, if we're going, gold standard, like we're doing everything possible, obviously money is no issue because I know all of this can get expensive over time. I definitely say do the biopsy, but, it's not a wrong answer necessarily to just monitor if that's what you choose to do.
Great. Can you describe a little bit, Blair, in terms of what's entailed with doing a liver biopsy? Because I think that there are some of us that might not know that.
So there are, different ways to get it. I mean, if it's something where for some reason there already is abdominal surgery being done, I mean, they would just get it that way. Where, you're already in the abdomen, they would take a small piece of liver, put a couple of absorbable sutures in, and be done. It can also be done, you know, if abdominal surgery is not otherwise warranted. You don't necessarily have to do that. It can also be done laparoscopically where you just take a piece. It can be ultrasound guided as well, where you take like a true cut and use that to get a section. I'd say that's probably more common if we're doing ultrasounds anyways. We don't otherwise need to do, you know, other things in the abdomen. But typically it's not like a huge procedure, but most practices would probably still, I would assume, put them under general anesthesia because you are taking a sample from the abdomen.
Great, thank you. Here's a question from Cheryl King. I have a 14-year-old Scottie that his liver enzymes have all of a sudden gone up. He has been on prophylactic antibiotics. And maybe Cheryl can tell us for what reason. And she's noticed it's given him more joint pain. Can this attribute to higher liver enzymes as well? Oh, for dental. Okay. He's been on prophylactic antibiotics for dental. Can you tell us how long, Cheryl, and what he's been on? She's not responding right now.
That's okay.
He doesn't.
Go
ahead.
She said she's noticed in the question joint pain after being on the antibiotics or after the.
Yes, it's given him more joint pain. And can that attribute to higher liver enzymes as well? But he's only getting it quarterly, so that doesn't seem, I don't know.
He's only getting the antibiotic quarterly? Like,
yeah.
Kind of like pulse therapy, is that, do you think what she's describing?
Yes, I think so.
Usually not. I don't usually see, or something that I haven't been familiar or seen while I've been in practice, is joint pain from antibiotics.
Right.
I think it probably would be unrelated to that. I mean, could the inflammation from the joints possibly be causing just kind of inflammatory values? Possible. You know, especially though a sudden like increase, like it's not been like a slow over time, you just suddenly have this increase in a liver enzyme. I would be more apt to think there's maybe something else going on there. And he was a 14-year-old dog, is that?
Yes.
Yeah, I mean, especially with age, unfortunately, the joint pain, I would more likely think, you know, arthritis, but it could look at too, and I mean, infectious causes. I mean, things like tick-borne diseases, stuff like that can cause, you know, sudden joint pain. With any of those, you might see elevations, you know, in liver enzymes, but, you know, with age, I mean, we can be looking at things like liver cancer, you know, other diseases as well. I think less likely though to be contributed to the antibiotics, the joint pain.
And especially since it's a pulsed therapy, it sounds like the joint pain is ongoing, not just when he gets the antibiotic.
Yeah.
He said it started since he started on the clindamycin is what he's on. So
yeah, not that I'm familiar with clindamycin causing joint pain. That hasn't something that I've come across. So I would think it's probably unrelated or related to some other, you know, secondary thing that's going on.
Yeah. Here's one from Allison Rainboth, who's in Wisconsin. They have Jock on a special diet developed by a Scottie breeder. It helped tremendously at first. We had essentially a complete reset with values back to normal. 3 years later, we are seeing ALT back up around 576. His affect is normal. Any suggestions? I am thinking Denamirin might be a good step now.
I mean, that would be the next step with the least side effects. I mean, then trying another, like any of the other medications. You know, just like, no, I mean, with any diets, with any supplements, I mean, if there's underlying issues, they're only going to help, you know, for so long. I definitely think, you know, it's worth trying it, doing a trial and seeing, you know, if you see any improvement at all on it. You know, if not, then I'd be looking at further diagnostics. But I think it'd be worth trying.
Okay.
Especially if he's otherwise, you know, asymptomatic, doing well.
Great. Thank you. I want to go back to the case with the Pablo getting the antibiotics being pulsed. Cheryl went on to say that she had an ultrasound done on him this year at the Door County Scottie Rally, and they did see a small cyst in his liver, but that was all. So could you talk about small cyst in liver? Should there be any further workup on that?
So that I'm not as familiar with kind of like the cysts we see. I mean, I guess would be hard to know just from ultrasound, exactly what's going on with the cyst without doing, a biopsy or looking at it further. But I'm not an internal medicine specialist.
Right.
They do this a lot more. If that's, who was doing it, who's looking at it, if they weren't concerned about the cyst, I wouldn't be as much either. But I guess if you're still continuing to see the enzymes increase, at that point, I probably would work it up more because it could even be too, you saw the cyst, but there might be something else going on now too, that they didn't see at that time.
Right.
Because what you said, this was like, what, 8 months ago when that was first seen?
In May, actually.
Okay.
Yeah.
Okay, this May. Were the enzymes elevated at that time, or has that happened since then? If we know that.
Cheryl, do you know what his enzymes were back in around May time, or when his enzymes went up? Yes, they just started.
Okay, so that's been a new thing since the ultrasound.
I think just before that. And they went, the enzymes went up further.
Okay. I would, if you're wanting to do more diagnostics, if the enzymes are continuing to increase, I would probably, say at this time it'd be warranted.
Yeah. And I think Cheryl makes a good point. At what point do you determine to continue to pursue things based on the dog's age, et cetera? And that obviously has to be owner preference as well.
Yeah. Unfortunately, there's no, easy answer to that. I definitely don't think it's wrong if you decide, they're, 14, they're definitely older. I'm not going to put them through that, especially if they're clinically doing well. I definitely don't think that's the wrong choice, but ultimately, that's a decision you need to make, you yourself or you with your veterinarian, and decide just how far are you going to go. If they're doing well, you're not seeing clinical signs, because there are too, we worry a lot about the liver, but there are, other things that can happen as well. So even if you work up this whole liver issue, is something else going to happen then, anyways. So that's really just, a personal choice you need to decide, think about your dog, how old they are, how much you want to do, what their quality of life is currently.
Absolutely. This is a comment from B. I don't know how to pronounce her last name, so I'm going to skip it, but it says, I have read that the liver enzymes in Scotties tend to be on the higher end, even if there are no health issues. Is this true / breed specific? And before you answer that, Blair, this is exactly one of the reasons why we wanted to have this presentation done, because all too often, it's very common for our veterinary care providers to say, oh, that's, it's a Scottie, they're always elevated. And our concern is, wait a second, there could be something that can be done to minimize that or improve those enzymes, and not just to write it off. So what can you tell us about that?
So, I think that the overall consensus they haven't decided is just a little bit of elevation normal for the Scottie or not. The papers I was reading, they talked about it, but there was no official consensus. Yes, this is normal. I think overall they were still saying it probably should be worked up, because the concern is, if we're seeing all these elevated liver enzymes in Scotties, the one thought is it normal for them, or is it normal that they have liver disease? In which case the elevated enzymes do need further workup. It's not just like they're high, kind of like a normal change for them that we're not worried about. Are we seeing they are more predisposed to liver disease? And that's why we see so many Scotties with elevated liver enzymes, if that makes sense.
Mhm.
So I would still say, probably should still work it up if we're seeing really much change.
Yeah. Here's another question from L. What is considered a minor elevation of ALT?
ALT, so we don't see that as big of changes in ALT as we do like an ALP. ALT, I mean, a small change, I'd usually look at, 10, 20, something like that, maybe a little less. Much other changes than that, I would say are more moderate to high changes. It's usually not as, I don't want to say more wiggle room, but I feel like an ALP, you can just get so high values at a small change. Even a mild change, we might say, oh, it's a couple hundred over normal, whereas with ALT, there's not as big of a kind of elevation typically that we see. So the ALT, at least personally, much changes in it at all for me, I usually think are worth kind of looking into further, much
Sure.
more than just a couple over normal.
Go ahead. Julie Allen has a question about her 5-year-old girl, Violet, was told post ultrasound that she has small adrenal glands. Is this a concern?
So, I mean, small usually is not as big a concern as, if they're, enlarged. It'd be more of a concern if it's, they were worried about, her not producing enough of the hormones that like adrenal glands produce, but it could just be too, sometimes things like, oh, it's a little small, I mean, can just be normal for that dog, unless it's something that they've seen like over time, they've been changing. I'd look at too, I mean, if she's not clinical, I wouldn't be as concerned. But if she is clinical, I'd look into it more. And then too, that's probably something I would, if she's clinical, see an internal medicine specialist about,
Mhm.
things like small adrenal glands.
Okay. I think we had one more question. Let me just double check here. These are great questions you guys are posing, by the way. I think this is more of a comment from Carol. She says, through my experiences with veterinarians, I know a lot of them are not familiar with Scottish Terrier diseases or symptoms to look for. Frustrating because they can be diagnosed. Mine was, how can we educate them or have them educate themselves?
Yeah, I mean, so that's a hard one. Because unfortunately there aren't, tons of Scotties out there. I mean, I know at my practice, I've maybe seen one or two. I was just more familiar with Scotties because of Barbara and, having her around. I think that's too, just trying to be, I guess, an advocate for your dog, knowing they need more workup. I know there's, some vets that don't always take suggestions well, but I would hope that most of them do, when you have concerns and, I guess finding a veterinarian that is willing to listen to you and, if you have concerns, want to do further workups, ones that are willing to do that. That is, I mean, it's definitely a frustration. And it is just hard because, there aren't as many Scotties out there. So it's not diseases that we do see as often, especially in general practice.
Right.
But definitely, I mean, of course, frustrating as an owner, just to, especially if you have a veterinarian that perhaps is not, is willing to move forward with diagnostics, if that's what you want to do.
Right. And if that's the case, then it's time to maybe think about getting a second opinion or changing practices, and not feeling guilty about that either.
Yeah.
the one thing I want to mention to everyone, and again, really great questions. You know, Blair mentioned the issue in terms of when that ALP is particularly elevated, that there's been a paper indicating, recommending ultrasounding every 6 months, the liver. And one of the things that we've started to do at the Scottie Rally, many of you know or have heard of, is the fact that we do offer abdominal ultrasound screenings every year in May. And we had to take off about 3 years, obviously 2 because of the pandemic, and then 1 or 2 years before that because the veterinarian crisis was starting to happen already, and I couldn't get vets here. But we have a situation now where we have an ultrasonographer who actually teaches veterinarians how to do ultrasounds. So she's able to come, and like this past 2 years now, we've had three people here doing ultrasounds. And one of the things with Kim, the ultrasonographer educator, she works with the vets that come, and they are learning from her additional things, which is great. But for a cost of $65, when you come to the rally, you get an ultrasound. If you sign up for an ultrasound, it's $65 is what we're charging. To get that done in a primary veterinary office, it's a complete ultrasound can run up close to $500. So it's not just a bladder scan you get anymore. It's a comprehensive abdominal ultrasound, which is really phenomenal. So I want to encourage those of you who come to rally, please get on that bandwagon and continue getting that done on an annual basis, not only because your liver enzymes, your dog's liver enzymes might be up, but also because of the bladder issue. So it's just a great deal. And for those of you who haven't been able to join us, it's one more good reason to think about coming next May. Couple new messages here. Let me just see them. Is being overweight a factor in elevated liver enzymes?
Yes and no. The being overweight itself wouldn't necessarily cause the elevated liver enzymes. I have plenty of, dogs I see that are overweight that don't have elevated liver enzymes. But the caveat would be, is the overweight, causing other issues that are causing liver disease? Then possibly, yes, seeing elevated liver enzymes, but just the overweight itself would not necessarily cause that elevation.
Great.
So I would not, I guess if the question is if you have an overweight dog that has elevated liver enzymes, I would still say to work it up. I would not just, toss it off to the fact that they are overweight.
Yeah. And I've seen this happen in people as well as in dogs. Oh, there's just a fatty liver.
Mm-hmm.
And can that really be said unless a biopsy is done? Or what does that mean?
No, I know that's something that, especially in people, throw it out there. I think, just based off of blood work, you can't really say that. Ultrasound even, they could see changes, but I think ultimately you'd still need that biopsy to know for sure.
Okay. Is there any protein to not have a dog eat if concerned about liver and portal shunt?
No, proteins, does she mean like different, like beef versus chicken, like
Yes.
that? So it doesn't really matter the kind of protein. It's more so just how much protein is in there, like the percent protein. And that, you're wanting to go kind of as low as possible. I know it can be hard in some of the diets. I guess in most of the ones I see, especially the kind of more novel protein diets, those tend to just be richer, have a higher protein content in them. So I guess in that aspect, things usually when I look at diets, sometimes like chicken ones, stuff like that, they just tend to have a lower protein percent in them. I think just because they themselves are not as rich in protein, but I wouldn't say it's the protein source itself, it's how the percent.
Okay. And any environmental issues that we've identified as attributing to liver disease? I didn't think so.
None that I'm aware of, unless it would be like different, toxins, things like that in the environment. I am not positive exactly, which ones those are that cause elevated liver enzymes. I mean, that possibly could be environmental, but just in general, there's none that I'm aware of.
Okay, great. I know that there's also a comment about how about a raw diet. I'm not sure if that is related to the question about a protein, or if there are concerns about, is there any link with liver disease and a raw diet?
Not that I know of. I mean, links at least. I mean but part of that could just be too, I mean, not a ton of research has been done on raw diets.
Right.
In general, I feel like most of the research I've seen with raw diets has all been related to teeth. So even if that link is out there, I'm not sure it's one that's really been looked at. I would just think, obviously the protein content is going to be higher in a raw diet. In that, I mean, just the amount of protein could potentially, lead to issues if we're looking at things like Schwan's microvascular dysplasia.
Sure.
But just the raw diet itself, I don't think there's really been research showing either way on that topic.
Yeah. And Cheryl has a final question here about sprays used on lawns, knowing that it affects or can contribute to bladder cancer. Do we think it might attribute to liver issues as well? There's not been any work done on that, but she's wondering if you think it might attribute to any liver issues.
It's possible. That I just don't know of for sure.
Sure.
But I think it's definitely a possibility. But it would be something that'd be nice to have more research on eventually to know for sure.
Right. Which brings me to my final comment, actually. Many of you have heard about the Health Trust Fund of the Scottish Terrier Club of America, and the STCA did a large survey about 4 years ago, not just among STCA members, but among people who own Scotties across the globe. And we had an incredible response to that. And out of the survey responses, we asked people to identify the common, or not the common, but the most concerning health issues to them. And liver disease came up as one of the top 7. And so I want to let you know that many of you know that I in particular been sort of on the bandwagon about trying to get people to contribute samples of blood to the DNA bank project that we've undertaken. And the purpose of that is to get a repository established so that we've got a lot of blood to tap into for research proposals. And all of this is going to position us to put out calls for particular types of research. So, every single one of us on this seminar today have had dogs with elevated liver issues. So I suspect that in the future, I can't tell you exactly when, but I suspect in the future, we will be putting out a request for proposals for researching liver disease. So please, if you have not taken advantage of sending in your dog samples, please contact me, private message me, Michelle Geiger-Bronski on Messenger or mgbnp1@gmail.com, and I can send you out those kits. Okay. Thank you very much, Blair. You did a fabulous job. Great job getting us through those questions and answers as well. And you have a special spot in my heart because of the role that you and your mom played in Barbara's life. So thank you. And I look forward to having you at Door County Scotland Yard in the future. Thanks, everybody.
Thank you for having me.
Bye-bye, Blair.